Hello everyone, how are you doing? Welcome back to my YouTube channel. I hope you're doing well. This is Voice It Out Broadcast Network, where we inspire change by helping you bloom beyond boundaries. My name is Wangere Njeri, and today is Nation Thursday, hashtag peace, unity, and freedom. Today we'll be talking about the burden of cancer in our country. And before I can continue, if you're a returning subscriber, thank you so much for returning and for being consistent. I don't take it for granted. And if at all you're new to my channel, thank you so much for passing by. Please subscribe, like, comment, and share. Tell a friend to tell a friend to tell a friend. Now, on Saturday last week, February 4th, 2023, as a nation, we joined the world in commemorating World Cancer Day, whose theme was Close the Care Gap, coming right at the end of the just concluded National Cancer Summit, where a report on the status of cancer in our country was launched. According to the report, cancer is a major health concern and is among the top 3 killers in our country. The report estimates that incidences of cancer have risen by 29.4% in the last decade, from an estimated 32,000 to 47,887. The deaths caused by cancer have also risen during the same period from 28,500 to 32,987. These are not just numbers, they are families grieving, breadwinners lost, children orphaned, and heartbroken widows and widowers, not forgetting to mention the financial distress that accompanies the treatment and funerals. The cancer problem in our country has proven that it is not just a health problem, but a socioeconomic problem as well, that we all need to reflect on what we can do to fight it. However, that will only be possible if we identify the gaps in cancer management in our country. The Medical Practitioners, Pharmacists and Dentists Union KMPDU highlight poorly organized and managed human resources for healthcare as one of the major gaps in cancer management. KMPDU represents approximately 10,000 doctors working both in public and private sector, which makes it fairly possible for it to tell us what really ails our health sector, especially in regards to this issue. Our country has registered approximately 14,000 clinical offices and about 58,000 nurses, serving a total population of 54 million Kenyans. Shockingly enough, out of this, there are less than 100 oncologists, that is cancer treatment specialists, translating to a ratio of 1 oncologist for every 540,000 Kenyans. The acute shortage, coupled with multiple county and national strikes by healthcare workers due to delayed salaries, limited resources, inadequate infrastructure, and the high cost of cancer treatment have contributed to the worsening number of cancer deaths in the country. The report further indicates that the most common types of cancer in our country include breast cancer, cervical cancer, and prostate cancer, with cervical cancer being the leading cause of death, claiming about 9 lives daily, but preventable through vaccination and treatable when diagnosed early. The challenge is having an inadequate number of well-trained and resourced personnel to carry out such activities. 70% of cancer patients, as shown in the report, are diagnosed at advanced stages, which raises the question about our ability as a country to conduct early diagnosis of the disease. According to another report by the National Cancer Institute, 2 out of 3 patients succumb to the disease. Only 23% of them have access to treatment and management services, again raising the question, what is the fate of the 77% remaining who are unable to get the help that they need? Training of cancer specialists is expensive, and that's the reason why the government should intervene to ensure the cost of treatment reduces. It's very important that the government makes cancer diagnosis, management, and treatment services affordable so that Kenyans who see cancer as a death sentence can have some hope. The government should also work in reducing the gap between cancer patients and cancer specialists. With cancer, we are all affected, and it is high time we all be responsible. Whenever the government campaigns for free cancer checkups and screening, let's not ignore, because cancer is treatable when diagnosed early. for cervical cancer that is preventable through vaccination, let's take our young daughters and sisters for vaccination. And most importantly, let's check on our diet and eat healthily. This is because our lifestyle also matters. It's often the small steps and not the giant leaps that bring about the most lasting change. Thank you so much for watching. This has been our today's episode on Nation Thursday, hashtag peace, unity, and freedom. And this is Voice It Out Broadcast Network, where we inspire change by helping you bloom beyond boundaries. My name is Wangere Njeri. Thank you so much for watching. Remember, if you've not subscribed, subscribe, like, leave a comment, share, tell a friend to tell a friend to tell a friend. Let's meet again tomorrow in our next video. Goodbye.